Governor Patrick Morrisey has publicly released the state's application for the Federal Rural Health Transformation Program. Morrisey calls it a once-in-a-generation opportunity to potentially bring over $100 million annually into the state over the next 5 years to improve health care. The plan targets what Morrisey calls the root cause of West Virginia's economic struggles: poor health keeping people out of the workforce. The Rural Health Transformation Program would fund 7 major initiatives, from expanded telehealth and transportation to workforce recruitment and technology innovation. The plan emphasizes prevention, including food as medicine programs and work wellness efforts. The governor says these measures will have a beneficial cascading effect that extends beyond health.
Imagine we can improve people's health. It creates such a virtuous cycle. Better health care outcomes leads to improved productivity. That leads to more people in our workforce. That leads to a better standard of living and a stronger economy.
The funding comes as West Virginia faces steep cuts to federal Medicaid spending in the same legislation that created the Rural Health Care Transformation Fund. Morrisey says the new program will help West Virginians get healthier and return to work, ultimately reducing dependence on Medicaid. The federal government is expected to announce Rural Health Transformation Awards by December 31st.